Hello, it's me again. So in the previous video, I showed you how to play with the new Skinxs2, the new layout, how to create a treatment from a questionnaire, and how to play with the patient card and all the different options that we have inside the patient view. Also how to filter your patient list here. In this video, I'm going to talk about something more exciting, the create treatment. This button here, and the way that we can create a new treatment or add a new patient to the database. If you remember well from the previous version, the way that we could create a new treatment or add a new patient was through a new questionnaire. So either we started a questionnaire, we review the diagnostic and create a treatment. There was a second option, which was fast treatment. So you just enter personal detail of your patient and then you create treatment without recommendation. So these two options are here. Quick treatment, so you create a personalized treatment without recommendation from the platform, so you are in charge, but that allows you to record the patient detail in your Skinxs platform and get all the follow-up features, sending the email, the ability to contact, for your patient to contact you again to reorder or renew the treatment. So if I click quick treatment, this is very easy. I just enter first name, email address. Here I create a new patient record and directly I go to treatment from scratch and I can create a full treatment for my patient. So let's say I want to create one serum morning and evening with ferulic, madecassoside and DMAE, for example, and I want to increase the madecassoside to 2%. And same with cleanse, rebalance and moisturize. I can add my product, so I have no recommendation from the system and I can validate the treatment. So this is a very simple way. I go through the end to validate the treatment. You see in 3 clicks I've got the patient card, new patient, I've got in treatment history, I've got the detail, and I know this is a 30 days treatment. The option to create treatment from questionnaire, it's here. So when I click, a new tab open, and the questionnaire starts from the beginning for this Skinxs account. Okay, if I come back here to unlock, I need to re-enter my password to unlock the page. Now this is the new features that we've been working on a lot. You're gonna get treatment recommendation and diagnostic only based on photo analysis. So I enter first name, email address, I just have to upload a photo. For in this example, we can upload, for example, a photo of this girl. And here the photo analysis is doing a lot of things. It's detecting, first of all, if there is a face in the photo, and then redness, oxidative stress, dryness, oiliness, texture, pimples, hyperpigmentation. So you can see here in a few seconds only, the system was able to detect a lot of redness for this patient. So if I show you the picture, okay, this is a low quality picture. If I zoom in, you can see a lot of pimples, you can see a lot of redness. And the system was able to detect this only based on photo. So on the left side, you see the simplified skin diagnostic. On the right side, you see the most recommended ingredient for this patient. We can see the pimples 10 out of 10, hyperpigmentation 8 out of 10. This is the post-inflammatory hyperpigmentation. A lot of oiliness and the hydration as well. Here what's new and what we are proud to do is we're not only using artificial intelligence for this treatment recommendation, we are combining the recommendation from the platform and the doctors. So the doctor can also review the diagnostic. So this is step 1, analyze the result and update if he wants to. So for example, if I see oxidative stress 3 out of 10, maybe she's a little bit more, I can change the score. Skin appearance 4 out of 10 because she has acne scars, so he was able to detect this. A lot of redness, a lot of dryness and dehydration, a lot of oiliness, maybe I'm gonna put it to 6 out of 10. Skin texture, pimple, acne vulgaris, yes. No acne rosacea, but maybe the doctor thinks she has acne rosacea as well, and she maybe has acne nodular, so we can update this. And hyperpigmentation due to post-inflammatory hyperpigmentation. So he was able to find this. And here we know it's a female, she's less than 20, phototype 2, thin skin. Step 2, clarification questions. So we have a set of about 10 questions that we ask for some patient to help us finalize the treatment recommendation. So in that case, only one question. If she's going to spend time in a warm environment with high UV exposure, and see recommended treatment. So then the patient card is open and we create a new patient in a database and create treatment tab, diagnostic based treatment on the photo analysis. So if here I can show detail, I can see my diagnostic again. I can zoom in on the photo. We can see it's a low quality photo, but it was able to detect a lot of things. And I can see all the detail here as well. Recommended treatment, morning and evening, azelaic B3, SOD, aloe, lactopeptide, madecassoside. So perfect treatment recommendation for her. Again, I can add complementary care, validate treatment, continue. I'm gonna send this email, and that's it. Within less than a minute, I was able to create this treatment only based on photo. Let's do another example. So last name is optional, as you can see. And let's take photo of this woman. Again, first step is to detect if there is a face in the photo. And then in about 10 seconds, running the algorithm, all the different types of algorithm we have put in place to create this diagnostic and select the most recommended ingredients. If I show the photo here and zoom in a little bit, we can see she has melasma and H-spot here on the forehead and the cheeks, and it was able to detect hyperpigmentation and redness, but no pimples, no pink. So if I go to next, female, it's an adult, phototype 3. You can see hyperpigmentation due to H-spot melasma. He was able to find it again. Next, here we have a little bit more question because, for example, pregnant, we ask if she's pregnant, maybe she's trying to give her retinol, so we need to know if she's pregnant or not. That's why we have this question. And if she has cold sore, for example. So let's say yes, and again, within a few seconds, arbutin, V3, SOD, aloe, madeca, zinc. Of course, I can see the list here. I can see because she's, I said she has cold sore, salicylic, phytic has been removed. Finally, let's do a third example. With this older woman, you can see the quality of the photo is pretty low as well. But we can, even when I zoom in, I can see here some brown spot, but it's a lot of pixel. And I can see all the wrinkles, but the quality of the photo is pretty low. And if I come back here to the result, skin appearance 10 out of 10, redness 10 out of 10, hyperpigmentation as well. He wants to give her arbutin. SOD, a lot of oxidative stress. So again, perfect diagnostic. She's more than 50. She has a lot of wrinkles. Here he was able to detect. And H-spot melasma. No pimples, no oiliness, and redness. Difference question here. For example, is she allergic to soy? Because it's trying to give her isoflavone, I suppose. And Yes, isoflavone, madeca SOD, aloe vera, vitamin B3, and phytic. So here he decided not to give arbutin among these choices, but preferred to treat the small hyperpigmentation that we saw with isoflavone. But if I'm the doctor, I could change it if I want to. So I hope you're very excited about this new feature. You can see in about 30 seconds you can get very detailed diagnostic of your patient's skin, a very accurate diagnostic and accurate recommendation. So now it's your turn to play.